Frankie!
Oh, look what you made me do.
What?
You made me prick my finger. Oh, I wish you wouldn't keep doing that. I hate being slapped on the back all the time. You don't know your own strength.
Oh!
What's the matter?
What's that red stuff on your finger?
Blood. My finger was pricked by the needle. Oh, don't say you're going to faint. I've heard of people fainting at the sight of blood, but robots fainting?
Oh. Maybe I'm really becoming a person now. Do you think?
Oh, maybe. You never know. Could you get me that iodine to put on my finger? It's the yellow stuff in the cupboard.
Iodine, okay.
Oh.
Yellow stuff. Ah. Here it is.
Oh, no, not that, Chips. That's the rat poison.
Rat poison?
Yes, for killing rats.
Could a person be killed by rat poison?
Oh, sure. Poison is poison.
Yes, it's written on the label.
Well, you don't even have to read the label to know that it's poison. Just look at the picture.
What is this?
A skull and crossbones.
A skull and crossbones?
It's the sign for death. Whenever you see a skull and crossbones on something, you know it contains a deadly poison.
Oh, then I'm going to put this deadly poison away and get the iodine.
Yeah, that poison shouldn't have been mixed up with the medication in the first place.
This doesn't contain poison, does it?
No, iodine is the opposite of poison. It's an antiseptic.
Antiseptic. That's a strange word. Explain, please.
Well, whenever something is poisoned or infected, we say it's septic. But iodine is the very opposite of this. It prevents poison and infection. So we call it an antiseptic.
So you're putting an antiseptic on your finger to prevent poisoning or infection.
Yeah, you can't be too careful. Prevention is better than cure. That's what I always say.
Uh-huh.
Thank you, Chips.
Okay.
Now, where did I put my needle and thread? Ah, here it is.
What are you doing with that needle and thread anyway?
I'm threading it. You see, I'm pushing the thread through the eye of the needle.
Well, why are you pushing the thread through the eye of the needle?
So I can finish sewing this bed jacket.
Oh, it's a stunning bed jacket.
Yes, it is rather stunning, isn't it?
Did you make it?
No, I wish I had. No, it wasn't made by me. It was made by my sister. She's very good at needlework.
Then why are you sewing it?
Oh, I'm just letting it out.
Letting it out? Where?
No, letting it out means making it bigger, so it'll fit my mother. She's in hospital, you know.
Oh, I'm sorry. What's the matter with her? Nothing serious, I hope.
Oh, no, nothing too serious. But she is having surgery.
What surgery?
An operation. My mother is having an operation. In fact, she's being operated on today.
An operation in a hospital.
Hospitals are places for people to go to who are maybe having an operation, and they convalesce in the hospital. Sometimes if you have an emergency, let's say you have a young boy or a young girl who gets hurt, has maybe fallen down and took a head bang, you bring them to the hospital, or somebody who needs stitches goes to a hospital. Somebody with a heart attack goes to a hospital.
The hospital has many sick people who are there to be cured of their illnesses. It's usually very big and fairly impersonal, as I find. I used to work in one, actually.
Okay, Glory, we're going to put you on the X-ray table here now. Just watch your head and sit up here. Okay, I'll help you with your leg if you just lie down. Great. Okay, just hold nice and still now, please. Okay, just hold still now, Gloria.
Gloria, these are the x-rays of your knee. We took them to make sure that you didn't break any of the bones while you were dancing. Looking at your x-rays, I don't see any broken bones anywhere.
Great.
Yes, but I do think you've damaged one of your cartilages.
What's a cartilage?
The cartilages are small cushions that sit in between the two bones. And I think while you were dancing, you've torn one of them. It's gonna have to come out.
You mean I have to go into surgery?
Yes, you're gonna need a small operation.
Gloria, this is an oxygen mask. It smells like rubber, but I just want you to take some slow, deep breaths. It's just oxygen, okay? I'm going to be putting you off to sleep now.
I can do that.
Oh, there you are, nurse. Better late than never, I suppose.
Pardon?
I said better late than never. Now come along, nurse. Scrub up.
Scrub up,
Yes, scrub up. Wash up.
wash up, scrub up. Why do I have to wash? My hands are clean.
Look, nurse, when I tell you to do something, you do it, and no questions asked. Do you understand?
I understand. Wash up.
Anyway, your hands can never be washed enough before surgery.
Well, why not?
Germs, yuck.
Germs. Oh. What are germs?
They're things that cause infection.
Infection is caused by germs? Oh, are germs poisonous?
Very.
Well, I don't see any poisonous germs.
Oh, they're much too small to be seen. They're everywhere. Get up!
Oh, they are? Well, you can't be too careful. Prevention is better than cure, I always say.
Gown.
Gown. Oh, here we are.
Do it up at the back.
Right.
Hurry up, nurse.
All right.
Yes. Now, mask.
Mask. Oh, mask.
Over the nose. Pull it over the nose, nurse.
Oh, over the nose. Why do you wear a mask?
So I won't breathe germs on my patient.
Pardon? I can't hear you through the mask.
I said so I won't breathe germs on my patient.
Oh. Oh, poor patient. Is he dead?
Of course he's not dead. He's alive.
If he's alive, why isn't he moving? Has he fainted?
No, he hasn't fainted. He's under anesthetic.
Anesthetic?
Yes, anesthetic. It's a drug.
You gave him a drug?
Well, sure, we gave him a needle.
A needle? Oh, is he going to do some sewing?
No, not a sewing needle. I mean this sort of needle, a hypodermic needle. We gave the patient an injection with a hypodermic needle.
You gave him an injection? You pricked the patient?
Yes, we pricked the patient. We gave him a needle.
Why?
So he won't feel any pain while he's being operated on.
Oh. Who is he going to be operated on by?
Questions. he's going to be operated on by me, of course.
So, you're the doctor?
Yes, yes. I am the surgeon, and you are the nurse. You see how it works? Now, can we get on with it?
You mean we're going to operate now?
Yes. I hope you're not going to let me down.
No, I won't let you down.
Good. Scalpel?
Scalpel. Oh, this cute little knife? Oh, it's really sharp.
Yes, that cute little sharp knife. Look, nurse, when I ask for something, don't ask questions. Just put it in my hand.
Okay. Oh, but you be very careful. This is very sharp.
Thank you. I know it's very sharp. I wouldn't want it to be blunt. I'm not going to cut open my patient with a blunt scalpel.
You're going to cut him open?
Well, just going to make a very small incision here.
Oh,
gosh, I'm good. Have a look at this, nurse. Nurse?
Active.
Passive.
Active. The bee stings the man.
Passive. The man is stung by the bee.
What happened to that man?
A bee stung him. He was stung by a bee.
Why is his nose swollen?
Because a bee has stung him. Because he has been stung by a bee.
What will the doctor do?
The doctor will cure him. He will be cured by the doctor.
How will the doctor cure him?
He'll give him some medication. He'll be given some medication.
What will the doctor do now?
He'll call a nurse. A nurse will be called.
What is the nurse doing now?
The nurse is bandaging his nose. His nose is being bandaged by the nurse.
Now what is the nurse doing?
She's sending him home. He's being sent home.
Cause
And effect.
germs cause disease.
Germs are the cause, and disease is the effect.
Smoking causes coughing. Cause, smoking. Effect, coughing.
Drinking causes accidents. Cause, drinking. Effect, accidents.
This accident was caused by a bee.
Bees cause accidents.
Yes, bees cause swollen noses.
now I'll put all the little skull and crossbones, the poisonous stuff, on this shelf, and all the medication on this shelf.
Hello, Mother. How you feeling, Oh, good. I'm glad the operation went so well. Well, what do you mean you're not in a private room? We took out extra health insurance to cover a private room.
There, finished. Now all the poisonous stuff won't get mixed up with all the medical stuff.
Would you believe it? There are so many people having operations right now that they can't give my mother a private room.
Should she be given a private room?
Yes, she should. We paid extra insurance to cover that.
What's insurance?
Oh, now where does the word insurance come from? Let me think. Oh, I know. It's related to the word sure.
Sure.
Yes. If you want to make sure of being able to pay your medical bills, then you pay some money every month for health insurance.
Does everyone have health insurance?
Most people do. Here in Ontario, we call it OHIP. Now look, this is my OHIP card.
OHIP, Ontario Health Insurance Plan.
Yes, and other places have other kinds of health insurance.
Does your insurance cover all your medical bills?
Most of them, but it doesn't cover a private room in a hospital. That's why we paid extra. But there aren't any private rooms free.
Well, what is covered by your health insurance?
Oh, visits to the doctor and operations and recuperation.
Recuperation?
To recuperate, to recover. You have to recover after you have an operation. It's quite a shock to your system, you know.
Oh, yes, I'm sure it's quite a shock to your system. All that blood.
Oh, there's not always lots of blood. But anyway, my mother's going to have to spend several more days in hospital to recuperate.
What a shame.
No, not really. It's the best thing for her. She'll be well looked after, well fed, well taken care of by the nurses.
But not in a private room.
No, she'll have to share a room with other people. And she'll have to share other people's germs, too.
That's right. There are germs everywhere. Have the germs infected you, too?
Oh, no, it's just a cough. Well, that reminds me, I should take my cough syrup. Now, where did I put it? Ah, here it is.
Oh, that's for a big cough. Wait a minute, Frankie. That's the same color as the rat poison. Oh, but it hasn't got a little skull and crossbones, so it must be all right.
Don't worry, I'm not going to poison myself. Anyway, just to make sure, you can read the list of ingredients.
Oh, this describes everything that's contained in the cough syrup.
Yes, it's a complete description.
Let me see now. Hyperlipoproteinemia phenolimun chloride. Well, who didn't? I don't understand a word of that. It doesn't describe a thing to me.
Nor do I, but it's not poison, believe me. Well, I'm off to the hospital. My mother's going to be needing this bed jacket when she comes out of surgery.
Oh, surgery. That reminds me, I had one more question.
Yes.
After you've been cut open by the surgeon, then what does he do?
Why don't you ask the surgeon yourself?
Sometimes when I'm not feeling well or the doctor tells me I need a certain drug or medication, I go around the corner to the family drugstore or pharmacy and I get what I need. Excuse me, miss.
Yes.
I need something for my hand.
Oh, how did you do that?
Some guy in a car cut me off and I fell off my bike.
Have you done anything to clean the wound?
Well, I washed it off with water at a nearby gas station.
Did you put anything on top of that?
Nothing.
Okay.
Nothing.
This is an ointment that should help you out. It has an antibiotic in it to help with an infection. What you do is you squeeze the ointment out onto a Kleenex and then apply it to your skin. Now, you don't want dirt to get in the sore, so you need to put a gauze pad over top. This should be a good size for that particular sore. Just put it on top, put tape around it, change it a couple times a day. If that doesn't look better in a couple days, give your doctor a call.
Okay, I will.
Okay?
Thanks a lot.
You're welcome.
Bye-bye.
Excuse me?
Yes, how can I help you?
I have a sore throat, so my doctor gave me this prescription. Could I get it filled, please?
Sure. May I have your address?
2180 Yonge Street.
Oh. Are you allergic to any drugs?
No.
Do you have a drug plan?
What's a drug plan?
That's where an insurance company pays for your prescriptions?
No, I'll be paying for it.
Okay, it'll be about 10 minutes.
Okay, great. Thank you.
Dr. Doe ordered erythromycin. It's an antibiotic, and you should take it 4 times a day.
Okay.
It's best if you take it 1 hour before your meals or 2 hours after your meals. If it upsets your stomach, though, take it with a bit of food.
Sure.
I've given you a little sheet that tells you more about the drug and its side effects. If you have any questions, give us a call. And be sure to take it till it's all finished, okay?
Great.
It's $12, please. Thanks a lot.
Thank you.
This is your wake-up call. Come along, nurse, and pull yourself together.
Oh, what happened? Where am I?
You are in an operating room, and I'm trying to finish an operation.
Oh, really? Who's being operated on?
My patient!
Oh, hi there. How's it going? Everything is under control, so nighty-night.
Now, pull yourself together.
Why? Am I falling apart?
No, you're not falling apart, but you did pass out.
I did what?
You passed out. You fainted. Really, a nurse who faints at the sight of blood.
I fainted? Oh, I'm so sorry.
All I did was make a small incision. It was just a very small wound, you see?
Oh, no, I can't look. Tell me when it's over.
It nearly is over. The operation is almost finished. Now, can we get on with it? I haven't got all day.
Okay.
Needle?
Needle. Are you going to give the patient another injection?
I told you before. When I ask for something, don't ask questions. Just put it in my... No, not a hypodermic needle. A sewing needle.
Oh, all right. Sewing needle. Are you going to sew a bed jacket for the patient?
No, I am not going to sew a bed jacket. I am going to sew the wound together. Now, just put the needle in my hand and stop asking questions.
All right.
No, a needle with surgical thread.
Okay. A needle with surgical thread. Oh, no, I can't look. I can't. Tell me when it's over. Why are you sewing the wound together?
So that it will get better. So that it will heal.
How long will it take to heal?
Oh, just a day or so.
And then the patient will be sent home?
Well, he'll have to spend a few more days in the hospital.
Oh, to recuperate?
Yes, to recover from the operation. First, he'll be sent to the recovery room.
Oh, yes. He'll have to recover from the operation. It's quite a shock to the system, you know.
Yes. Do stop talking, nurse. Swab.
Swab? Who are you calling a swab?
I am not calling you a swab. Just hand me a swab of cotton wool.
Oh, okay. Oh, and what do you want this swab of cotton wool for?
How many times do I have to tell you when I ask for something, don't ask questions, just put it in my hand?
Swab!
Iodine?
Iodine. Oh, I know what iodine is. It's an antiseptic to prevent the wound from becoming infected by germs. That's right, isn't it?
What did I just tell you?
I know. Not to ask questions and put it in your hand. Iodine.